To the third speaker, my friend, Dr. Zmerly, please, stage is yours. He's going to present the synovial chondromatosis, the recognition and the treatment options. Thank you very much.
Good morning to you all. Thank you for the moderators and for all my friends to be here. My talk is about synovial chondromatosis, the recognition and treatment. Synovial chondromatosis is a benign and common condition of the synovial membrane of joints, tendon sheaths, and bursae. It is a metaplastic process that consists of multiple hyaline cartilaginous nodules in the subintimal connective tissue of the synovia. So it is a metaplasia, a process when a tissue produces another type of tissue. And the result is the formation of cartilaginous nodules and loose bodies in the joint space. Usually, synovial chondromatosis is monoarticular in the large joints and with multifocal presence in the same joint. And generally is intraarticular, but we have also an extraarticular form. The knee joint is the most affected joint, but all synovial joints can be affected of synovial chondromatosis. The etiology is unknown, but it may be related to trauma, inflammation, degenerative, or genetic factors. And we have two types of synovial chondromatosis. A primary type that occurs without any known origin, and the secondary one associated with other joint condition, like in this case. So the pathogenesis is a metaplasia. We have the production of cartilaginous tissue inside the synovial membrane. And these nodules can grow and feed in the joint space with the formation of loose bodies. These loose bodies can grow and can calcify or ossify. And the masses erode the articular cartilage and can lead to joint damage and dysfunction. Milgram classified three phases of synovial chondromatosis. The first one, when we have only an active intrasynovial disease without loose bodies. In the second one, we have intrasynovial nodules and loose bodies. And the late phases, when we have only multiple free osteochondral bodies without evidence of intrasynovial disease. The clinical presentation include pain, swelling, limited joint motion, joint crackling, joint block, the presence of these masses that can lead to deformity of the joint, and the most important sign, the presence of loose bodies. X-ray and computed tomography can show the radiopaque loose bodies, but MRI can show all loose bodies, the cartilaginous one, the ossified one, but also the synovial tissue features. So the hypertrophia, the reaction of synovia, and all characteristic of the synovia in this disease. The differential diagnostic must be done with all loose bodies in the joint. Here we can see our classification, our etiopathogenetic classification of loose bodies, because we think that loose bodies must be classified based on her etiopathology, because when we know the origin of this disease, we can do better the treatment. So it is important, the imaging, the X-ray, MRI, the CT scan in some cases. It is very important, the arthroscopic characteristic of this disease. We can see an intrasynovial nodules, a pedunculate nodule, a free loose bodies. In this case, we can see the different phases of the disease. In the some case, it is important also to analyze the gross pathology of the fragment and the histopathologic features. Generally, it is not necessary, but in some cases, when we have a book, the histopathology is important. On microscope, we can see a well-circumscribed lobule of hyaline cartilage surrounded by fibrous band. The most important aspect is the cartilage cells arranged in clusters. This is typically for the synovial chondromatosis. The lesion is hypercellular with nuclear variation in shape and size, and frequent the presence of binuclear cells. And the treatment. Generally, the treatment is a surgical treatment, but in the early phases, in some cases of secondary synovial chondromatosis, in asymptomatic case, we can do a conservative treatment. But the appropriate treatment for synovial chondromatosis of the knee is the arthroscopic treatment. In some cases, it is necessary an open approach or a combined arthroscopic or open approach. The treatment consists of the removal of loose bodies and the synovectomy. The synovectomy must be the more aggressive possible. It is important to have familiarity with all access, with all arthroscopic portal to reach every compartment in the knee. Here we can see our cases of synovial chondromatosis in the ankle joint, in the anterior and posterior compartment of the ankle. The treatment was an arthroscopic remove of all loose bodies and a synovectomy by anterior and posterior approach. And in the right of the picture, we can see the X-ray at 10-year follow-up. It is very important to follow this patient and monitoring the patient for long period of time, because the reoccurrence and the complication can be verified after a long time. The open approach is necessary when we have a large fragment, and when we have severe osteoarthritis, the treatment is the joint replacement. So in conclusion, synovial chondromatosis must be recognized. The diagnosis is based on history, physical examination, imaging, and histopathology. The treatment is arthroscopy. The open approach may be necessary in some cases. The reoccurrence is frequent from 3 to 24% of cases. And rarely the lesion can lead to malignant transformation. Thank you.
Thank you very much, Hassan. Nice talk. And you've opened the talks regarding the treatment of the different diseases of the synovial membrane. Now I'm very happy to introduce